Good afternoon, everybody, and thank you to the organizer for having invited me. Just a little precision, so I'm Italian, but unfortunately I left my country a long time ago, and at the moment I'm working at the Innovative Medicines Initiative in Brussels, so that's my home at the moment. And and I would like just to give you a little overview of what we are doing at IMI for this important problem that is becoming more and more a problem for everybody. So first of all, I don't think I need to convince at all this audience of the importance of Alzheimer's disease in our society. And here are just some numbers, how many people we have currently that have been diagnosed with Alzheimer's disease and what are the projections for the future. So if we think about the number of millions of people that have now diagnosed in the world for Alzheimer's, this is only projected to increase more and more. And if we think for 2050, the number will be well above 100 million. And while, of course, we are in Europe, we consider the importance of FAP for European citizens, but we have to be well aware that this is a global problem. I think as we often hear about also global epidemics when we're talking about problems like antimicrobial resistance, when we talk about diabetes, but indeed there is also an emergency of a global epidemic for Alzheimer's. And if we think about the developing countries, indeed the statistic and the last WHO report indicated that at least 60% of people with dementia live in developing countries. So now, if we think about fact and challenges for Alzheimer's disease, I mean, again, I think you are all more than aware of this, but there is no drug treatment that is really available that can provide a cure for Alzheimer's disease, so it's an incurable and finally fatal disease at the moment. And the medicine that have been developed can improve symptoms, so temporarily maybe slow down a little bit the progression, but they can only do it in some people. And as already mentioned for another speaker in an earlier session, the last drug approved for treating the symptoms of Alzheimer's disease has been Memantine in 2003. And really what is really also, even for these 5 treatments that already are on the market, is that really there is no way yet to predict who will respond to a treatment. So, and also there has been many trials. There is a lot of activity to try from the researcher, from the pharmaceutical companies to try to develop new drugs. But unfortunately, up to now, what, for example, has been seen to be promising in preclinical model, in animal model of Alzheimer's, then has been always become a failure when treated, when reached the clinical stage of testing, either for safety problem with the drug or simply because it didn't work, or if efficacy could not be proved, I think, more correctly. And so if you think about what are the real challenges, it's actually, as also already stressed by other speakers before me, is that it's clear that in the most of the healthcare systems, dementia is underdiagnosed and is also diagnosed too late. And what now the research is showing is that indeed, if one can look at the brain of individual with this condition, actually the sign in the brain can appear very decade before the symptoms appear. And also what the research says is that there could be much more chances of success if the treatment could be started much earlier. Now, if we look at what is research in Europe on Alzheimer's, unfortunately, the picture is not really good. So what we can say is that there is a lot of research going on, but still is very fragmented and also so not synergistic. So it really is important that something should be done for this, because really everybody has to work together if something has to really be changed. And really, because really what is important is that really we need to find a way to get to identify the right drug that could be given to the right individual at the right stage, and most importantly also at the right dose. And it's clear that for this to happen, there is need of a real innovation, and it's real that we need new research tools, new models, new methodology to translate what is found in the lab of many universities to patient, and also learn to the patient so that this learning can get and inform the models. And most importantly, we really need collaborative models to do this better. And really what this model have to involve all the important stakeholders, from patient group to regulator, to the academic, to the small, medium-sized enterprise, to the pharmaceutical companies. We need to be able to take advantage of all the data that are out there, very fragmented and maybe still in silos. And also, of course, we need the funding to do all this work, because otherwise nothing will happen. And the institution where I work, the Innovative Medicine Initiative, is a public partnership that has been created between the European Union and the pharmaceutical industry under the umbrella of the FPI organization to promote a collaborative research program, joining forces in the healthcare sector and try really to involve all the stakeholders, including patient organization, hopefully now also, let's say, individuals that have the different condition. And I must say that Alzheimer's disease is really an area of high interest and where we have been working and we will work more in the future. And today I would like just to give you very shortly some information about two projects that are ongoing. Each of these projects is a public-private partnership. That means that it's run by a consortium where we have side-by-side individual participating, and that come from academics, from a hospital, also from the industry. So we have scientists from the industry that work hands in hands with Sander from the public, and also patient organization, because in both this project we have Alzheimer's Europe as a full consortium member. And the first project that I would like to talk a little bit about is the Pharmacog project. It's a project that now has been running for 4 years, has this very long name, a prediction of cognitive property of new drugs candidate for neurodegenerative disease in early clinical development. To take things more short, this is slides that explain everything. This is the very bleak picture on how it has gone with a clinical trial for Alzheimer's in the last 10, 11 years, and 101 drug trials have failed. And if you see the last one, as I said, for memantine was in 2003. So clearly there is some problem there. And really what the Pharmacog project is trying to do, in a nutshell, is really to try to develop tools and methods that will allow a better research and a better development of new treatment for Alzheimer's symptoms, to try to determine what is the best treatment and dose that has to reach an individual with this condition, and also to try to pave the way towards the development of new treatment to modify Alzheimer's disease. And now he's doing work in an animal model of disease in different species. Then he's also doing work to try to develop some surrogate model in human volunteers. For example, is now clear that sleep deprivation cause, not dementia, but cause cognitive impairment, and also via magnetic stimulation is possible to mimic some of the symptoms, so that some drug can be tested already in human volunteers that are willing to do this for the benefit of everybody. And then, of course, also research involving individuals with the condition. And what the project is working on is to develop a new wave of cognitive testing that can be used both in preclinical species and then in the human volunteer and in the individual with the condition, so that results can be translated directly, because this is a big problem, as I said, until now. And also to develop new biomarkers that can be found from simple blood testing, and also to look a new way to measure the activity in the brain in the most easiest and less invasive way, but also look at brain imaging, both in animals and in humans. And just to give you a little example, for example, what Pharmacog has been developed is looking at, for example, at using EEG, so just measuring the waves of the brain, which can be very simply, not invasively done. And this is also a very cheap sort of test. and is translational, can be used in men and in animals. And this has been used both for the development of new models, but also to demonstrate the possible effect of drugs, which, if this can be further developed, then of course validated and agreed with the regulator, could be used to test new treatment. Another important initiative is the European Medical Informatics Frameworks, or EMIF in short, which is a very big project. We have nearly 60 participants participating to this activity. There is a platform, and there are 2 research projects. One, and what is the platform, is a platform that is looking at how to use for research all the data and the knowledge that is in the electronic health records, and which means data that can be accessed and can be used for more than 40 million people. And that will be used for 2 research programs, one looking at obese people and the development of diabetes, and the other one instead will look at looking at risk factor and protective factor for the development of Alzheimer. And most interesting, there is also a collaboration between these 2 research programs, because there is quite an evidence that there is a correlation between diabetes and Alzheimer, which is extremely interesting for the future. For developing new approaches. And what is most important is also that the project is developing a very secure platform, and really to do all this work, taking care that all the privacy and legal issues are very carefully taken care of. And really what is the aim of EMIF-AD is really to try to do research and developing diagnostic and also progression biomarker to try to help the situation that now Alzheimer diagnosis, as I said, is really done too late, so that it's possible to modify its course, and also that it's really not easy to follow the disease progression using what is available now. And just really the aim is really to try to understand better what is Alzheimer in Europe, so to understand the variability of this condition in different parts, and try to understand what can be really the factor that can lead to Alzheimer in different parts of Europe. What is it? Is it then something to do also with the environment, as well by the genetic of the people in different parts of Europe? And this hopefully would help to understand better about the risk factor and on the development and the progression of the disease, and also maybe hopefully provide new target for research and one day drug. And just to see you about an interesting results that already come from the project in collaboration also with other initiative, is really work that has been done in individuals that don't have any symptom for Alzheimer, but that they have been studied for biomarker present in their cerebrospinal fluids, and the results of this study has indicated that indeed there are quite a good percentage of people that after the age of 65 have this marker in their cerebrospinal fluid, even if they have absolutely no symptom of Alzheimer or even mild cognitive impairment. And this is indeed highly associated with increased risk to develop impairment, to increase risk of developing Alzheimer, and also, unfortunately, with an increased risk of mortality. So this is clearly indicating that it's very, very important to continue to research and to understand better what can be the factor for the risk factor and the protective factor also that could be important. So really, just to what is doing IMI up to now is really to try to do research, having all the stakeholders together to try to develop tools and methods for production of the right drug, for the right patient, at the right stage, at the right dose. And this is done both by the EMIF-AD project and for the PharmaCode project. And also we have other projects, for example, in the area of depression, in the area of chronic pain. And in IMI, we try to have link with all this initiative, because also, as you are all aware, depression and chronic pain are also conditions that are quite relevant in dementia. And we also have a relationship with other initiatives in Europe, like the Joint Programming Initiative, and in the States, like the CAMP initiative from the Clinical Path. But we are also working towards future activity in Alzheimer, which is really becoming a really flagship of IMI. We have currently in negotiation a project called Ezionomy, where people will work to try really to get advantage of all the data that are out there from literature in open source spaces and link it with data that will be provided by the project itself to try to understand more about the etiology and the classification of patient and try to lead to a more mechanistically based classification, not only a classification based on symptoms, in order to hopefully pave the way for a better way of doing drug discovery for this condition, and also to optimize the benefits risk of therapies so that the individuals that have not a chance to benefit for a treatment will not be exposed to something that is not useful for them or could be very risky, but on the other hand, that individual that might have instead a mechanism of causing their condition that give to different phenotype can be identified, and so they can all take advantage for the same targeted therapy. And indeed, again, also Alzheimer's Europe is a full consortium member of this upcoming consortium. We are also working still also for the future, and we have now trying to develop a new topic for IMI that hopefully will be still launched in IMI 1 or maybe next year, which is really to try to establish a public-private partnership to conduct new adaptive clinical trials for Alzheimer's disease, because indeed, as you said, until now, the way the clinical trial will run is not very effective, and indeed, it doesn't give the results. And clearly what is important and what this initiative will take care of is to try really to understand who should be treated in this clinical trial, with what should be treated, and how can really the result of the treatment be observed and demonstrated, and when this treatment should be started. And this, as I say, will be hopefully still in IMI 1, but we are now in a transition phase to a new IMI 2 that hopefully is now in the hands of the Parliament, but we all hope in the office that they will be going through, and we start sometime next year, the IMI 2 initiative. And here we have already a first drafted research agenda, and that has been drafted by the pharmaceutical companies, and is really saying that Alzheimer's disease is one of the areas that is really key in for also the future activity IMI 2, and indeed the title of the research agenda is the right treatment, prevention and treatment for the right patient in the right time. And as you say, is really also for Alzheimer's, it's really important really to try to work towards really to look at the risk for individual to develop, so that it's possible to create some management of this risk, and also really to optimize the way that treatment is delivered to the patient. And for this, I would like to stop here, and I'm happy to take any question if there is time. Thank you very much.